Hi, it's Jessica DeMassa with WTF Health, What's the Future Health? You're joining us for our special COVID-19 series in which we're talking to different health tech companies about how they are helping out in terms of handling the coronavirus outbreak. So today I have with us Russell Glass. He is the CEO of on-demand mental health startup, Ginger. So Russ, it's great to have you with us.
Always good to talk to you.
Thank you. Thanks so much. Thanks for taking the time. So you guys are doing some really cool stuff in the space of mental health. And I know you guys sell primarily to employers. And so you've been helping them take care of their employee populations by using the mental health services you provide through a virtual care platform. So this is kind of like a combination of behavioral health coaching that's provided on a telehealth platform, in addition to telepsych and some other, more serious stuff. So one of the things, though, that I recall reading here relatively recently is that you guys have seen a huge uptick in utilization, 50% over the previous 6 months in February and March alone. And you guys have done a study on some of the, how COVID-19 is impacting stress level of employees. So talk to me, I guess, a little bit about this, from the front line, helping support employers, taking care of their employee populations in this really important aspect of their health. What are you seeing out there?
Yeah, actually, interestingly, the data that you're referencing is a couple weeks old now, which in this world makes a huge difference. So we're seeing clinical sessions, so therapy and psychiatry sessions are up 130% over the last 4-week period. We're seeing, we're seeing daily active users up around 88% compared to the pre-COVID period. So and actually, interestingly and relevant, we're seeing intensity of conversations up significantly as well. So we measure, we ask our providers to measure, we ask on a 1 to 5 scale, how intense are the conversations you're having? And that helps us to load balance when we're, providing care to thousands of people. And those intensity measures are up 25, 30%. So we're seeing more people, we're seeing more acute, and we're seeing more intense conversations over this period of time. And we did a bunch of research around this. We have our workforce attitudes report that we do annually, but we decided to rerun it. So we did it, it finished in February, and then we reran it 4 weeks later to see what happened, not only from an annual standpoint, but from the last 4 weeks. And some of the results are incredible. The one that really stands out to me is 70% of respondents said that this is the most stressful period of their career, 5 times more stressful than the crash of '08.
Wow.
And the 9/11 periods. So unprecedented amount of anxiety, stress, depression going on right now.
I saw that report, and one of the things I was interested in about that too, I'm hoping you can speak to this a little bit more, was that there was a big difference in men versus women in terms of how they were handling the COVID-19. Talk to me about that, because I thought that the divide along the gender line was surprising to me, because usually you hear, in terms of mental health and seeking treatment, men have are typically, a lot less likely to seek services to help. So tell me, I guess, from what you saw there along those gender lines, I thought some of those statistics were really interesting.
Yeah, it's fascinating. I mean, the summary is women are doing far better than men are during this period. And for example, men are finding that they're missing days of work at twice the rate that women are missing days of work right now. They're finding it about 60% more likely to be have difficulty collaborating with colleagues than women are having right now. They're missing meetings at more than twice the rate that women are missing meetings. And I think there's a number of theories about this. We don't know for sure what's causing this. I think part of it is, though, that women are more used to having to balance home and work than men are. And so they're just more adjusted to this kind of juggling. Mm-hmm. And it's a very new experience for most men out there. But we certainly see women are doing far better than men are.
The other thing I thought that was neat too is you had put this out on your own LinkedIn. I went back to take a look at it again, actually, was about the number of use or the amount of usage going up in the overnight period. So from 10 p.m. to 6 a.m., seeing like a really big uptake there. And I'm just thinking to myself, like, wow, the impact on people sleeping. Like, That's so insightful, I think. And then, I think to myself, like, connect the dots through that. That could also, lead to a number of other healthcare conditions.
Yeah, it's interesting. Right now, we're seeing about a 50% increase in the number of people who are accessing us between 10 p.m. and 6 a.m. And 76% now of time spent on Ginger is outside of working hours. So, I think we're seeing both a change in how people are accessing mental health care, but to your point, the people aren't sleeping as well, which leads to a kind of a flywheel effect. You're not sleeping as well. You can't handle the stressors and anxieties and changes as well as you would if you're sleeping better. That leads to worse sleep, which leads to worse anxiety, and you get into this cycle. And so a lot of what we're doing today is helping people to break that cycle and helping them to make sure they need to focus on exercise, focus on sleep, hopefully get a mindfulness practice going, and just work on these things that keep you mentally fit during a period like this.
I know you guys, your client base is primarily large employers who provide this then to their populations as part of their health benefits package. So what are you hearing from, like, your points of contacts in these employer organizations? I'm really curious to hear what kind of feedback you're getting. I mean, maybe on some of the statistics or even on the utilization rate. I mean, what are the things that they're saying back to you as a result of finding out some of this stuff about their employee populations?
Yeah, well, there's a few things. So we mostly focus on large employers, but also SMBs. So we have packages to help small to medium businesses as well. And, a couple of stats. One is demand. So inbound interest is up about 4x
wow.
the last month. So significantly higher amount of companies reaching out to find out how can we help, right? So that's one. Two is the adoption rate. So 40% of users are reporting that they have used some sort of technology driven mental health experience in the last, or in their life, right?
Okay.
40%. 62% of those have used it for the first time in the last 4 weeks.
Wow.
So if you think about the math of that, basically you've doubled the amount of people, more than doubled the amount of people who've ever tried something like this in the last 4 weeks. That just demonstrates the size and change. And, from an employer standpoint, what we're hearing is, look, continuity planning wise, we need to be thinking about the mental health of our employees. We know that they're struggling. We know that this is a totally new experience. And if we're going to keep our business growing or keep our business running, we need to make sure that there's a mental health aspect to it. And, they're seeing all kinds of things, and we're seeing all kinds of things, from increased variability of mood, so bigger mood swings than you might typically see, to kind of overwhelm with news, so just too much content, too much absorption of information, can't make sense of it all, to fear of, am I going to get this thing? Are my parents going to get this thing? Am I doing enough am I wiping down enough stuff? Every bit of our lives right now has additional stressors. And all of that adds up to, overload, right? Mental overload. We talked briefly before this about how tired you are at the end of the day. A lot of that is this overload that's going on. There's overload. This experience of being on video all the time creates cognitive work that wouldn't be done. There's a great article in Psychology Today about this. It all means we have to take extra good care of ourselves right now.
Yeah, absolutely. I even read Bloomberg put out, I think it was yesterday, that our work hours from simply working at home have been extended on average 3 hours more. So whether you realize it or not, on average, you're working 3 hours more because there is no beginning and there is no end. It's very different than being in an office, environment and changing your situation, not having the commute to get yourself psyched up or take yourself down, and, the separation of it. I mean, I know every time I work from home typically, and it's like I walk by my home office and sometimes I just can't look.
Totally. Well, a little like tip, right? So same thing. I need to take breaks. I need to step away or else I'll just keep working, right? Well, as you can see, I leave my golf clubs now in my view. Right? They're behind me there. So that just reminds me, go outside and chip. Like, go outside and, take a few swings. Just step away. And little things like that can help you. Like, if I do that a couple times a day and step away, it's a big difference to my overall ability to, get back into it, be thinking clearly, and manage some of my, stresses.
No, I totally get that. I wanted to ask specifically about, so we were talking about employee populations in general and employers, and I want to circle back and end on kind of talking about where you think the industry is headed. But before we do that, I do want to talk specifically about this program that Ginger has launched for frontline healthcare employees. So my understanding, and tell me if this is maybe old news too, but you guys are offering for free access to Ginger, so the behavioral coaching platform through the app, free for frontline healthcare workers through June. Is that still the case here?
That's correct.
That's correct. And so tell me a little bit about how that's going. What have you seen in terms of signups? And, maybe if you can talk a little bit about some of the insights you're gleaning from looking at the data with that particular population that, really is bearing, a very different brunt of emotional and mental stress in terms of dealing with this pandemic.
Yeah, well, so first we sat around when this first started and said, okay, how can we help? Like, what can we do as Ginger to make sure that as many people as possible have access to the kind of care we can deliver? So we did 3 core things. One is what you're describing here, which is we made it available through healthcare providers for all their frontline employees to get access to Ginger for free. 2 is we said, okay, well, what about the general public? What are we going to do for them? And we launched all of the sort of content and exercises that we provide in our app, we made free for anybody to be able to access at ginger.io/roots. And so anybody can go in there and, relevant exercises to this situation we're going through, things like work from home, things like isolation, things like parenting, people can access for free.
Okay.
And then finally, we created a program where our employers, our primary customers, as you mentioned, don't have to sign long-term contracts anymore. So they can get started and they can end it at any time because we realize that they just can't plan long-term right now, right? And so those are the 3 things we're doing. In the case of the healthcare work side of things, we've had incredible interest. And I think the thing that's most, the learnings there are, there's like 3 different types of core stress that these people are going through right now. The first is almost like pre-stress or pre-trauma. It's like, what am I about to walk into? Super scary, right? Then it's in the actual act of providing all of this care, how do you make sure that you can stay calm, that you can stay focused, that you can stay, at your best when you're working all the time, when you're in this dangerous situation, when you're not sure about, how sick someone is or if you're going to catch it or whatever. And then finally, it's how do you recover when you're done with your shift and have to come back the next day into the same stress. So those are the 3 areas of focus that we think, we can be most helpful with.
Yeah, I mean, it's mind-boggling to me what these frontline workers are going through. I mean, the stress of it, and I think that's interesting that you've managed to identify those 3 different areas of it and are trying to address each of those separately. Great work there, I think, and also, in terms of providing the access to the platform to support it. I think that's awesome. So congratulations and kudos to you guys there for doing that. I want to come back around and talk about industry in general, because I've been asking, I've had the opportunity to talk to a couple of different people who are, leaders of companies that are in telehealth or virtual care. And, mental health has always been kind of the shining use case in terms of telehealth, as far as I'm concerned, only because it seemed like it was a very easy cognitive jump for a lot of health systems or health plans or employers to integrate in, like, oh yeah, of course we would do this face-to-face over a phone. It makes total sense. And I think utilization, in terms of, matching supply and demand, that's always been off a little bit. And so that helped open that up and solve that with different kinds of resources. So I know you guys are kind of stratified. You've got your behavioral health coaches, which are different from licensed clinicians, and as you go up the chain. So I'm curious, as you see some of the changes that are evolving here around telehealth, virtual care, that kind of impacts your business, as far as like, the practicing across state lines now, being able to do that without restriction, that's been temporarily lifted, or even some of the reimbursement things we're seeing in terms of reimbursing virtual visits for telehealth at parity with office visits. How is this impact? Like, what do you see happening, from your vantage point, specifically focused, on the Ginger experience? Like, what do you see happening moving forward in terms of virtual care? Where do you think that this part of the health tech sector is headed? Do you think these changes are going to be rolled back? Like, how do you see this unfolding? Predict the future a little bit for us.
Yeah, sure. We're certainly seeing some significant changes here, as we talked about, just in terms of the demand shifts, right? And number of people adopting this kind of capability. And the interesting thing is for Ginger, the mental health system was completely broken before COVID. The supply-demand imbalance was like wildly upside down. There's far fewer providers than are needed to provide the care for this population. And now it's just all exacerbated. But Ginger has been focused all along on trying to solve some of those problems. So what we're seeing this period is that adoption's way up. There certainly have been some regulatory changes that are helpful. So a simple example is the waiving of the Ryan-Haidt Act. So the ability to prescribe controlled substances via telehealth versus having to go in person is a big difference. And it allows us to handle more conditions than we'd be able to handle otherwise. Some of the state line stuff is a little bit of a red herring for us because the states still ultimately control that. And it's still pretty complicated in terms of where you can actually cross over state lines, where those waivers are. If I had to predict the future, I would say, one, the demand's not going back. Because once you try telehealth and you realize how convenient it is and how effective it is compared to going into an office and putting yourself at risk of catching something else, of having to drive there and deal with the time side of it and sit in the waiting room and all that stuff that nobody wants to do. Once you recognize the value of telehealth, you're going to start there from then on, right? So I think the demand shift's not changing. And that's going to be beneficial to companies like Ginger and companies that are focused on that, like Doctor on Demand and others. I'm not sure about the regulatory side of things. I think that some of the laws, because demand is so much higher, may stick. But it's hard to say what's going to happen because of the state-by-state nature of this. It's hard to get states to agree on anything. So the federal government might do some stuff that sticks. I'm dubious that the states are going to all of a sudden say, and their medical boards are going to all of a sudden say, oh yeah, let's waive this for good. I mean, I'm not convinced.
Okay, fair enough. What do you think about the reimbursement side of this? Do you want to weigh in on that at all? Do you think this is going to bring, not just even like the telehealth visits, at parity, but do you think that this is going to elevate the whole sector? I mean, we're even seeing too now, FDA loosened regulations around digital therapeutics for mental health last week. So now all of a sudden this is a thing too. So what do you think?
Yeah. So I think it's the right move to do what they're doing. Because the demand is so much higher and because we're going to witness, this is like a great experiment.
Isn't it?
Of the efficacy of telehealth versus non-telehealth. I think we are going to see reimbursement change for good. I think we're going to reimburse for telehealth on a much more parity as we were in physical health. I think that FDA, I think it's temporary. I think, and it should be temporary. I think it's smart. Let's get as much out there as we can and see what works. But we also need to make sure, if you look at the wild west of digital therapeutics, right, someone needs to regulate that and make sure that people are getting value out of these things. So I expect that to retrench a little bit, although it's a good time to get things out there again in a test mode and see what's working and what's not.
Yeah, I definitely agree with you on that. It's like this whole thing is kind of I keep saying, I'm like, this is like the moment where, digital health, telehealth, virtual care, remote monitoring, it's like the spotlight is on us. Like, and I've asked a couple people, I'll ask you for your opinion here too, Russ. How do we, in your opinion, how do we not mess this up? Like, this is our golden opportunity to really kind of prove like we've been preparing for this for years. How do we not mess this up? How do we really prove our use cases, you think, as health tech companies, for these big guys who are now kind of relying on us to help offload the burden from traditional methods of care delivery?
Focus on outcomes. Focus on delivering great member value, great outcomes. And if you can do that in a consistent and scalable way, you're not going to mess this up. It's when you focus on the wrong things, and basically anything short of focusing on outcomes, in my mind, is the wrong things. That's when you could see this going astray.
Okay. Russ, thank you so much for letting us pick your brain. It's a pleasure to speak with you. Keep up the great work over there at Ginger. It's such a much needed service. I mean, taking care of ourselves is just a really important thing all the time, but especially right now amidst the chaos of this pandemic. So thank you so much for taking the time. I really appreciate it.
Always a pleasure to spend time with you, and thanks for making this an issue that you want to discuss.
All right, no problem. Well, if you guys want to check out more chats that I have with different health tech leaders about COVID-19, please check out my YouTube channel, or you can find them all at wtf.health/COVID-19. I'm Jessica DeMassa. That's Russ Glass, the CEO of Ginger. Thank you so much for joining us.